Welcome to the Garfield Center. I'm Jennifer Lieberman, the director of the Garfield Healthcare Innovation Center, and in 2006 I led the effort for Kaiser Permanente to turn this warehouse into a Hollywood-style movie set that would enable the people of Kaiser Permanente to envision the future of healthcare and then actually empower them to go out and create it. So to understand what we do at the Garfield Center, it's helpful to understand our process. At Kaiser Permanente, we draw heavily on design thinking. And to walk you through the innovation process, I would like to introduce you to Patricia Marino-Price.
Thanks, Jennifer. Using the innovation process, we have 3 phases. The first phase of the process is inspire. In order to come up with good ideas, we have to go out and really understand what's happening. So we go and talk with real patients and doctors, understand where the biggest needs are. And we also look at emerging technologies, and we look at other contexts. We look at what other industries are doing to get inspiration. In the next phase, in ideate, we brainstorm new ideas. We think about all the possibilities, and then we take the best of those ideas and we try them out. We prototype them here at the Garfield Center so that people can get an idea of what's working and fix things and evolve things. And then we take those ideas, once we feel like they're good enough to take into the real world, and we go to the next phase. The third phase is impact. We work with real patients and doctors, we go back to the people that we talk to, and we see if these ideas really make their problems better.
So today we want to walk through how we might envision the future of healthcare. And we're going to draw on 2 of the innovation phases that Trish just explained, inspire and ideate. Let's start with the problem. Healthcare is going through some significant changes. The first big thing is a demographic issue. As the baby boomers age, we're going to see a lot more demand for healthcare services. We also have some healthcare reform issues where we actually have to do more with less, which is both challenging and exciting. The pace of technology is also increasing rapidly, and some people predict that as much as 80% of what physicians do today could be replaced by technology. So the question that our leaders asked us was, how could we envision a future of healthcare in 5 to 7 years that would be transformed by strategic partnerships, emerging technologies, and also focused around the patient? To make these ideas more real and meaningful, we actually designed for personas who are fictional characters but are based on real people. And in this case, we designed for a persona, Gina Hernandez, who's 27 years old. She and her husband, Oscar, are very excited because they are expecting their first baby. We have a big question of how might we transform healthcare in 5 to 7 years? But to narrow this and help us solve the problem, we asked the question, how might Gina's home enable access to care and support her health and wellness during her pregnancy? So to approach this problem, we started in the inspire phase, and we went out and we observed interactions between our patients, our doctors, nurses, and we even asked them, what would you like to see in the future? We also interviewed a lot of our senior leaders and technology experts to understand where things were going. And then in the ideate phase, we came up with a ton of ideas, and the challenge for us was whittling them down. That there is no one single right answer for innovation. In fact, innovation gets better as people build on each other's ideas. And if you take an idea that maybe didn't work in one environment and try it in another, you can come up with some really interesting solutions. And what we ended up creating was a prototype that's really a provocation for the future. And it's an interactive experience that we bring people to the Garfield Center to walk through. And the experience starts when you get to experience Gina's day. So we start on a Saturday morning. Gina and Oscar are sitting in their kitchen having breakfast. And this is about her 10th week of pregnancy. After they're done with breakfast, she has a video visit with her care team that consists of a doctor, a nurse, a nutritionist, and a wellness coach. And in this video visit, she gets advice on how to manage her gestational diabetes. After she's done doing that, she has to take a diagnostic test just to make sure that her baby is okay. And one of the things she does is, because this is in the future, and it may seem a little weird, she blows on a sensor in her phone, and the sensor analyzes her breath and gives her a result that her baby is actually quite healthy. At the end of this scene, Gina and Oscar are sitting on a sofa, and there's a sensor that actually alerts them that they haven't been very active, and so they have to get up and take a walk.
Thinking about the ideas that Jennifer just talked about and the ideas that you came up with, we want to help you build on those ideas. So part of the ideation process is to make new ideas even better or to broaden the ideas that you can choose from. So take worksheet number 2 and pick your top 3 ideas, your favorite ideas that you've heard today. Then think about different ways to change your perspective. So for example, think of a different person. If your favorite idea was, instead of for Gina, it was for you or for your best friend or maybe your grandmother or your teacher, how would that idea be different?
You'd probably be surprised to know that there were about 30 people who helped us with this project.
That's right.
Doctors, nurses, technologists, interaction designers, architects, even our patients. I mean, there was a big cast of characters that help us behind the scenes invent the future of healthcare. So my story is actually about the age of 13, I realized that I wanted to have a career in healthcare, and it took me a little while to find out where my place was, and I'm glad that I experimented. I went to college and got a degree in political science, and I worked in a healthcare policy field, but I really wanted to be closer to the action. So after I'd paid off all my student loans, I then went to graduate school at UC Berkeley. I was enrolled in the MBA and the Masters in Public Health program, and one of the best things that I ever did was take a class in the engineering department. So my advice to you is try new classes, try things that you might not even think you would like. I actually didn't think I would like physics in high school, and I had an amazing experience. The other thing is, not all jobs have job descriptions. Sometimes you actually have to go out and create them, like I did with the Garfield Center here. So Trish, you have a story to tell too.
I was born in Ecuador in South America, and when I was 2 years old, I came to the United States. When I went to college, I went to Columbia University in New York, and I studied psychology and Hispanic studies because I was very interested in people, and I was also interested in how people work together in cultures, especially my own culture. And when I graduated, I thought I was going to be a teacher, but the internet started to come up, and it was really getting going, and it was really neat. I was like, what's this all about? So I studied a little bit more, and I took some animation classes, started to make my own websites, and decided to go back for my master's at New York University. And I studied interactive telecommunications, where I could knit all of my passions for people and for technology and for art into one place. I encourage you to take as many classes as you can, follow your passions, always be curious, and find out what you like along the way.